What's up, everyone? I'm Dr. Josh Madsen, owner of Infinity Neuromotor Developmental Centers, and I'm going to answer some questions, and I don't know what they are. So here we go. If you weren't a functional neurologist, what would your career be? I would be a real estate investor, or someone that does anything around real estate. I love real estate. I love working with kids more, but I do really like real estate. Who would win in a fight? One Silverback Gorilla versus 100 men. 100 men, obviously. We're going to your Colorado clinic in a few months. Can you talk more about that clinic? Yeah, that clinic's awesome. We have multiple different providers out there, different specialties, different backgrounds. That clinic started this last summer. I had a patient that came here after having multiple concussions, and we rehabbed him, and his dad wanted to get involved and help us open a clinic out there to serve that area of the country. And so we opened out there this last summer, and it's been awesome, and we've been working on building our team out there, and you'll have a great experience there for sure. How do I know if my child has PANS or PANDAS? This is a great question because this is often mislooked at, to be honest. So for us to have PANS or PANDAS, this is Pediatric autoimmune neuropsychiatric syndrome, or pediatric acute onset neuropsychiatric syndrome associated with streptococcal infection. If I didn't say it right, not bad. But what you need to look for is you actually need to look for the antibodies against brain tissue. That is the key. That's what makes it an autoimmune disorder. So you're looking for antibodies against anti-dopamine 1, anti-dopamine 2, anti-tubulin, anti-oligoganglioside. Those would be the main autoimmune markers that we're actually looking for. The medical test that runs that is what's called a Cunningham panel. That's how usually your medical provider might do that. There's different functional labs that I believe are actually a lot better. There's two different ones that I would typically recommend. One would be a NeuralZoomer Plus through Vibrant Labs, or Cyrex Labs has a panel as well. I can't remember the name of it off the top of my head. I really like the NeuralZoomer Plus simply because what it does is it looks at those markers, but it looks at 45 other markers or antibodies against central nervous system tissue, and also the most common infections that can trigger that. So strep is one of those. Different herpes infections, Epstein-Barr, CMV, those are all on there as well. It's actually a clinical diagnosis. So it's basically they have neuropsychiatric syndrome symptoms that change very quickly, usually pretty abruptly. And on top of that, the actual DSM criteria is they have to have, I think, like 3 other symptomatology of like maybe tics, repetitive activities, OCD, anxiety that goes along with it as well. So there's it's a clinical diagnosis, but from what I think is the gold standard is looking for those antibodies against central nervous system tissue, and that really is what confirms it. Hope that makes sense. Okay, what are some of your most memorable patients? What did you do to help? Ooh, this is a fun one. I have a lot of memorable patients. I've been really blessed. I've been able to work with a lot of really, really great families, really great kids. Some of my most memorable, I'll just tell you a story. So I had this kid come in that had a severe traumatic brain injury. He fell off the back of a truck. Many of you guys watching this probably know who this is. I'm not going to say any names, but he came in and he had such a severe brain injury that he died on the scene. Basically came back. They had to remove half of his skull because he had so much brain inflammation. When he came into our clinic, it was months after he had gone to a great rehab facility right after it, and he could barely walk, and he was just yelling profanities at me constantly. Every time I moved him, he'd yell profanities at me, and that's funny simply because he's the sweetest kid I've ever met in my life after the fact. But he went down to Dr. Harsh's clinic to do hyperbarics, and he came back so much more stable, and he came back the sweetest kid ever. And then we got to work with him for the next couple of years. And the best part about it, the joy of it for me, was I got to see him go from that state to graduating high school, to graduating college, to having a full-time job, having his own home now. And I've got to see this transformation over the last 6 years. And that's the most rewarding part of me, of seeing those changes over time. Because it's one intensive is one thing, but when you get to work with a patient for years and see how they can really progress and change, and especially when they put in a ton of hard work, which this family and this person did, it's so cool to see what changes over time. That's probably one of my favorites. But man, I've had so many awesome patients and just ones that are so much fun to work with, but that's one that just will probably always stand out to me, and always will pull on my heartstrings a bit. Do you work with adults? I mainly see children in your videos and wasn't sure if you also treat teenagers, adults, etc. Yes, we do. I love working with adults. I would say probably 90% of our clients are pediatrics. I do love seeing adults though. I love seeing, obviously I love working with kids, but probably my second favorite people to work with are adults that have Alzheimer's, dementia, Parkinson's, people that have had traumatic brain injuries. Those are super fun for me. More complex the neuro rehab that needs to be done. Those are my favorite patients to work with. So the ones that have a lot going on that no one else has been able to figure out, I love seeing those because we just look at things so much deeper, so much more holistically, so many different systems. So we're usually able to figure out pieces that other places just have kind of missed or glossed over. And I had my own challenges as a kid. I had my own challenges as an adult. I had a mold toxicity that caused I had lots of chronic pain, lots of chronic fatigue issues. My family suffered from different things as well that we've been able to work through. So a lot of these kids that come in, maybe they had a mold issue or infection issue. And if there was a mold issue, that some of the other people in the family have those same, started having cognitive challenges and brain fog and memory issues. And that's where I was. And now that's kind of I really love working with those patients simply because I went through it. Anytime I've gone through something like, I struggled with learning as a kid. That's why I became so passionate about kids. But now as my life has changed, I've struggled with different things and been able to work through those things where a lot of people get stuck. And so those are some of my favorite patients to work with. And I have a family history of my grandparents had Alzheimer's and dementia, and so seeing those things has brought a passion for those things as well. So that's why I enjoy it. All right. How long have you been married? Let's see, this year will be 11 years. So coming up on 11, we just had our 10-year this last year. Ooh, is there always a root cause for cognitive impairments or learning and intellectual disabilities? Always is a very strong word. There's typically something going on that is making those things worse, right? So maybe a child's born with a brain abnormality. Maybe they don't have synapses or connections in certain areas of their brain. So like there can be those types of reasons, right? There's always some kind of reason there. But what we like to look at is what are the things that got missed? Do they still have primitive reflexes? Do they have eye tracking issues? Like, you're amazed at how many kids come in here that have a diagnosis of dyslexia, which is obviously a learning-based issue, but on top of that, they have massive eye tracking issues and they can't track a single thing. Well, how much harder is it going to be for that child to learn that has dyslexia if they also can't track their eyes? So now there's compounding things. There's never just one thing. It's always a multitude of different things. And the more different things that you can look at, like improving their eyes, improving their balance centers, improving primitive reflexes if they're present, improving brain energy, if that's a dysfunction, which many times it is with kids that have learning issues, you can dramatically change how they learn and their intellectual function. So from my point of view, I don't know if there's always a root cause, but once you start looking, you usually find some things that make a dramatic difference for them. Ooh, how is it being a girl dad? It is completely different than being a boy dad. It's calmer. It's, at least so far, it's calmer. I'm sure once she turns 13 or something like that, it's going to be a completely different story. She's calmer. She's easier, just in general, I've found. I get awesome snuggles, which is fantastic. I got that with James as well, but not to the same level. But I feel like it's still too early to tell. We're only 14 months in, but so far it's just been overall been a little bit, she's a little calmer. So hopefully that answers it, but I love it. Do you own any pets? I do. I have 2 Australian Shepherds named Norman and Oliver. They're crazy. Well, individually they're fine. Together they're crazy. But I love them. Those are our first children. Oliver is I think 10 or 11, and Norman is 6 or 7, I think, off the top of my head. Yeah, but 2 crazy Australian Shepherds. My kid is crying out of nowhere for a few minutes while nothing's happening. Any reason? Sometimes you'll see this. Sometimes you'll see kids that just start laughing randomly. Sometimes you'll see kids that have, weird things that happen like this. I often think when I initially read this, I go, what's going on with the basal ganglia? So the basal ganglia turns on and off systems at appropriate timing. So we have 3 different loops that run through there. We have a motor loop. So when that doesn't turn on and off at appropriate timing, you usually see tics. So repetitive movements of their head, their eyes, a repetitive stim, something along those lines. But what a lot of people don't realize is, because it's not as visible, is there's limbic loops that run through there. So we might have big emotional dysregulations. There's also a cognitive loop. So we might perseverate on things or get stuck on certain things and we can't get out of it, or maybe we get really anxious or OCD. Those loops all run through that basal ganglia. So if that basal ganglia is not functioning efficiently, or maybe we have autoimmunity against it, or whatever it may be, there's many different reasons, we can see something like that. So that's where my brain instantly goes when I read that. I don't know if that's going on or not, but that's where my brain goes. Ooh, what's your worst wipeout while wakeboarding? That's a good one. I've had many. I used to wakeboard a lot. I've had multiple concussions from wakeboarding. I remember this one time I was doing a backflip, it was called a tantrum, and I landed and I face planted and my board came behind me and smoked me in the back of the head. That was probably one of the worst ones I've had. I was disorientated for a while there. So that's probably the worst one. I had an even worse one though, kneeboarding, where I knocked myself out and I woke up underwater. That one was pretty scary too. But yeah, I've had many. Is it true you get your hair cut at Great Clips? It is true. Well, it is true for a while. I haven't recently. I got a new haircut person probably this last year. But yes, up until then, Great Clips was my place to be. Okay, what's so important about getting rid of primitive reflexes? Do they actually affect anything later in life? Yes. Okay, so primitive reflexes are reflexes that everyone has. Me and you, looking at this camera, we both have primitive reflexes. Our brain is typically just functioning well enough to inhibit them so we don't see them. When you see primitive reflexes, it's a sign. It's a sign that the brain either doesn't have enough energy, isn't connected well enough, or isn't functioning well enough to inhibit the reflex. We should all be inhibiting those so we can move more efficiently, so our eyes can track more efficiently, so our body can move more efficiently. So don't think of it as the reflex is the problem. The reflex isn't necessarily the problem. The reflex is the sign that there is a problem. And when we start rehabbing the right areas of the brain, or we get energy to the brain, or we change their diet, or maybe we get rid of a toxic stress going on in their life, their brain can function well enough to start inhibiting the reflex. So now we know we have a healthier brain. It's a sign that our brain is not functioning well or healthy enough. That's why it's really important. And yes, later in life, it can cause a lot of issues. Like you usually start seeing things like maybe it depends on the extent. If there's a ton of them present, you're gonna see more issues. If there's one present, your brain can compensate for so much. It's crazy what your brain can actually compensate for. But what you'll see is, a lot of times you'll see learning issues, you'll see reading issues, attention issues. Maybe you'll have, as you get older as an adult, maybe you'll just have random muscle tension in your head and neck and shoulders are chronically tight. Or maybe you get chronic headaches. Well, a lot of times an ATNR or an STNR never went away, and that's creating chronic tension. So a lot of the things that we commonly think of as these maybe just normal aches and pains or dysfunctions, sometimes they're coming back to reflexes that shouldn't be there. But in all actuality, just think of them as there's a sign that there's an issue going on that once it's addressed, the reflexes go away and usually the patient does a lot better. Ooh, this is a hard one. What are 3 books you'd recommend to read before you die? Oh, if people don't know this, I actually don't like reading. I like listening to audiobooks. I retain way more. I've probably listened to over 1,000 books, so this becomes really hard. The Big Leap is one of my favorites, just from a mindset perspective. From a business perspective, Buy Back Your Time is a really good one. And then spiritually, Thoughts Determine Your Lives. Those are some really good books that I would highly recommend. What do intensives at Infinity look like, and what's the process? So kids will come here anywhere from a week to, we've had kids come for up to 6 weeks at a time. They do an evaluation on the first day. Usually a lot of times we're doing a consult ahead of time and maybe ordering some labs ahead of time, depending where you're at, and or doing them while you're here to figure out underlying causes and dysfunctions going on. And but then we're doing an exam to figure out what we're actually going to be rehabbing, and we're looking at the normal developmental sequence a child's supposed to develop in, and that's also the way that we're going to rehab them, is what's the most developmentally appropriate stage for them to be at. Like, for example, let's say a kid comes in that's 3 years old and isn't walking, but they still have a bunch of primitive reflexes and have never crawled. I'm going to work on their primitive reflexes and crawling before I ever start working on walking, because developmentally, that is the most important sequence. God created our brains and our bodies to develop in an appropriate sequence. If we can match that, the kid's going to do so much better, is what we've found time and time and time again, no matter what symptoms they come in with. So when a kid comes in here that isn't speaking or walking, I'm not jumping straight to their symptom of let's just try to get them to speak or walk, or do therapies to speak or walk, because they're not developmentally ready for that. We need to go back and we need to look at what's the foundation, what are the pieces that they missed, and let's rehab those specific neurological findings. And eventually that builds to them improving in these other areas, but that's where we got to start at. And so depending on the child, that every care plan looks different, and we do a call ahead of time to determine what's the best place to start. What's your favorite sport? Fun fact, I don't even have cable, so I don't watch sports. But I really like to run. I really like to cycle. So for me, those are things that I enjoy doing. But I don't really watch sports because I'm a weirdo. And I think it's a waste of time.
What?
I got important things to do in my life, and sitting and watching sports is not one of them. What led you to start Infinity? So a lot of people know this. I've owned businesses since I was like 10 years old. So I started mowing. I had a business mowing. Then I had a window washing business. All the way through college. That was awesome. And I've always owned, my dad's owned his own businesses, and we've I grew up in an entrepreneurial family. And so I knew going out of school that I was just going to start my own clinic. So I graduated at the very end of October, and I opened at the very beginning of December. I signed my lease for my first building as soon as I passed my Part 4 boards before I ever graduated. And my build out was nearly done by the time I graduated. So I knew no matter what I did, I knew I was going to start a business of some kind. And when I went into chiropractic, I knew I was going to start my own clinic. And in those first years were way more challenging than I ever thought they were going to be. To be honest, I had no patience for a long time, but it also was a blessing in disguise, because it allowed me to, if I would have been busy right out of the gate, I wouldn't have been able to learn the extent of what I learned that now helps so many kids. And so there's always a reason for, maybe slow times or things that you think aren't good, but in the long term, it turned out to be the best thing that could have ever happened to me. What's your top 5 favorite movies? Okay. Dumb and Dumber is definitely probably one of my favorites. Top Gun is another one 1 and 2. And let's see. Troy is another one of my favorites. I also really like Talladega Nights. So, okay, last one. Is hypotonia treatable in Down syndrome? Okay, this is a good question. So traditionally that would be a no, but we have seen a lot of progress in hypotonia with our M-Field. That system we got probably a couple years ago, and we've been using it for kids that have hypotonia, whether it's Down syndrome, whether it's other genetic reasons, maybe it's an injury or things along those lines. And that tool, if your kid has hypotonia, that tool has been the absolute coolest machine to use to start getting tone in kids that have low tone, and it works so well. It takes a couple weeks of really consistent use to start building that tone up, but it's pretty wild. When a kid comes in and we start using it, we have to turn the machine like all the way up to get any type of musculoskeletal response at all. But over time, as we use it more and more, those numbers get lower and lower and lower, and they get bigger and much more larger contractions of those muscles. And then over time, the brain makes these connections, these muscles start firing, they start using them, and then that's when tone really starts to develop. We've seen some really awesome changes with hypotonia and muscle tone that I honestly did not think was possible, but that M-Field has been a game changer for our patients. So if your kid's struggling with that, come to us to do M-Field and other therapies, but if we can't get here, find someone that has one, because it's a really valuable tool for these kids. And now my bowl is gone, and that's all the questions I have. Hope this helped you guys out. Have an awesome day. Peace.